Okay. Well, good afternoon or good morning. Letting folks get settled in here virtually. Still a few people connecting to audio. I see Kevin still trying to get connected in there and a couple others. So let's give them a chance to get connected in this Zoom world. We continue to wander through. Great to see some familiar names and faces. Frank, it's good to see you on. Of course, Kevin's coming on, and even Clem. We've got Clem. Clem is here as well. So, Clem, good to see you. And yeah, some others coming in too. That's great. Thank you so much for joining us this month for another installment of our essential substance abuse skills webinars. Got a great presenter back with us. Dr. Avis Garcia is here, and I told her it's like putting the band back together. So we're excited to have her back, and looking forward to 2023 and a lot of initiatives and things we've got planned for this year through our center. So yes, it's great to see everybody again. I want to just say good morning or good afternoon. It looks like, yep, Kevin is in now. Kevin, good to see you connected. And there's Ben. Ben has joined us. Ben, right on.
Good to see you, Steve.
Yeah,
good to see everyone.
Too. Yeah, you too. Just saying we've got Dr. Avis Garcia here today, and we're looking forward to hearing from her. We're going to share some important information, and those of you that have attended or continue to attend, or perhaps for the first time are attending this webinar series, this group of modules is really designed for both the seasoned professional that may be coming in looking for just some refreshers or to collaborate or connect with other colleagues, but it also is designed as an introductory sort of format for those that maybe are thinking about getting into the field or are interested in becoming certified or licensed and are just getting ready to enter the field. So we really want to welcome everyone. And today's presentation, I'm Steve Steiny, by the way. I'm one of the managers here at the American Indian Alaska Native Addiction Technology Transfer Center. I'm broadcasting to you live from the University of Iowa, the College of Public Health, here on campus in Iowa City, Iowa. I also have with me my colleague, Cam. Cam is one of our communications coordinating providers. She's just going to stay on for a while to make sure that I don't break Zoom or anything like that. But if you are having trouble with your audio or having trouble connecting or hearing or with your video, send her a private message or let us know, and we can try and troubleshoot that for you. It might be something on our end that we can assist you with. And of course, I have here with me Dr. Avis Garcia. Avis is one of our consultants and advisory council members here at our center, and we're happy to have her back. So I've just got a few introductory slides that I'm going to go through. As most of you know, how that goes, and then I'm going to turn the floor over to Dr. Garcia to let her talk a little bit about where she comes from and how she's connected to our center. And while she's doing that and stalling a bit, I can put up the next series of slides for everyone, our main slide deck. So let me go through a couple of slides. Again, my name is Steve Steiny. I'm a manager here at the American Indian Alaska Native ATTC, our national center here at the University of Iowa. So again, let me just say, this ESAS is the Professional and Ethical Responsibilities module. So a lot of good information. Some of it may be review for those of you that have some experience in the field, and for others, it may be something you're hearing about or processing for the first time. As many of you know, this event is brought to you by the National American Indian Alaska Native ATTC. We are a national center made up of 10 regional offices around the country, including a national Hispanic and Latinx center. And we also work closely with our HTC Network Coordinating Office at the University of Missouri in Kansas City. Again, most of you are aware that this project is supported and funded by SAMHSA. The content is developed by the presenter, and the opinions expressed today do not necessarily reflect the views of SAMHSA, HHS, or the American Indian Alaska Native HTC. Again, we will make these slides available in PDF format, and we'll reach out to you post-event through our center's email listserv. And based on your participation and attendance today, we will make available to you these slides. We are recording this event. We'll add that to our archives. Some of you may already know about that, but if not, we can certainly post a link to that archive in the chat today, or I can send it to you via email if you reach out. It's really a great resource. It has, particularly the last 3 years, as many of you are aware, as many of us have done, a lot of virtual events, and we've recorded almost all of them. So we've got a really nice repository of virtual webinars and different trainings and workshops that we've done over the last almost 3 years, and then even post or pre-pandemic recordings as well. We'll also be able to offer 1.5 NADAC approved CEUs if you're gathering CEUs for your credentialing purposes. We can certainly make a certificate available, and you can request that certificate of attendance at the time that you receive the follow-up email. Lastly, I'll put a link to a very short survey in the chat box today, and you'll also have an opportunity to fill that out in the follow-up email if you don't get a chance to fill that out today. So this survey is important to us. It's not mandatory, but we would really appreciate hearing back from you. We've added a couple of short answer questions into this survey so that we can really hear from you in your own words. The survey is completely confidential and cannot be linked to you in any way. If you have questions or concerns about that survey, reach out to myself or Dr. Garcia or Cam, and we're happy to address any concerns you may have. Before we get started, I know we are gathered here virtually today, but we would like to take a few moments to pay respect to the indigenous nations whose homelands were forcibly taken and inhabited. Please take a few moments to read this land acknowledgement, which was created by 3 former members of our team from the Meskwaki and Winnebago nations. Thank you. Well, without further ado, I want to introduce today's speaker, Dr. Avis Garcia. She is an enrolled member of the Arapaho tribe and is affiliated with the Eastern Shoshone tribes of the Wind River Reservation in Wyoming. She is currently in Montana, but I think is planning to move here this year at some point. But right now, I know she's coming to us from Montana. She is a licensed professional counselor and has a lot of experience. Over 20 years, Avis. I'm just going to say it out loud. And
Yeah.
you've got a lot of experience working in the behavioral health field, particularly in the addictions field. So
Yes.
we're really happy to have her here. I'm going to turn the floor over to her and she can tell you a little bit more about herself. Just a reminder, you all are muted right now, but use the chat box feature or the hand raise feature, or we should have a little time at the end. You can unmute and ask any questions or have any comments for Dr. Garcia. So I'm going to turn the floor over to her. I'm done speaking for a bit here. So Avis, you have the floor. While she's speaking, I'm going to go ahead and get up the next slide deck. So thank you.
Okay.
Thank you, Dr. Garcia.
Okay. Good morning, good afternoon, everyone, wherever you're tuning in from. I see people across the country are here for today's presentation. I am from the Wind River Reservation in Wyoming, born and raised there. And I am currently working for the Crow Tribe in Crow Agency, Montana. I've been here for close to 2 years now, running their outpatient substance abuse program under a 638 contract through Indian Health Services. I provide clinical supervision to all of the staff that are employed there as direct service providers. I have some counselor trainees. I have an intern from the community college, well, a couple of interns, and a couple of social workers who have been in the field for quite some time as well. Today's topic that we're going to be talking about is the professional and ethical responsibilities. And this is something that is very important on the exam, but in your work as a professional in this field as well. I myself am taking the time to walk my staff through the NADAC Code of Ethics, which we'll talk about more when we get through these slides today. But thank you all for taking time out of your busy schedules. I like to do trainings in these webinars because I like to teach, and I've been with this program since 2019. So I've been doing these for quite a while now, and I really enjoy doing this work and teaching people. So we can go on ahead and get started with today's presentation. So the objectives for today's webinar are: we will cover the ethical principles, autonomy, non-maleficence, beneficence, social justice, fidelity, and veracity. We will cover the 13 principles of effective treatment, discuss professional code of ethics and ethical responsibilities, code of ethics, patient rights. Go ahead, you can go to the next slide. Covering boundaries and supervision. The vocabulary that is specific to this module today is our morals, our principles, and our ethical values, and our scope of practice. The next slide. Substance abuse disorders are complex and treatable diseases that affect brain function and behavior. There is no single treatment that is appropriate for everyone. There are different types of treatment that are readily available, and effective use has to attend to the multiple needs of the individual and not just the drug use. And remaining in treatment for an adequate amount of time is critical to the length of stay. So each person that we provide services to has special, unique needs that we can't do a cookie cutter approach for everyone that walks in the door. Substance abuse works and people do recover, and there's more than one way to provide treatment to individuals. So being knowledgeable in all the different interventions and theoretical approaches and the different types of programs, also keeping in mind that a majority of these people that come seeking our services also need mental care. A lot of them I have learned in my over 21 years of practice in this field is a significant portion of people struggling with substance abuse have trauma. And so as I've progressed in my career, I've also become a certified trauma specialist because I realized that this is something that is really prevalent in Indian country is the intergenerational trauma and the current traumas. And being in a different reservation community and talking to others across Indian country, I find we have a lot of common traumatic issues that our clients face. We can go to the next slide. Behavioral therapies are the most commonly used form of drug abuse treatment. Medications are important, but it's not necessary that everybody needs to be on medication. Individual treatment plan is your guide and should be continually used throughout treatment and modified as needed. An individual with a substance use disorder, like I said, they also have mental health disorders. I would say at least 50% of the people that come in are struggling with some sort of mental health disorder. And detox is just the beginning stage of treatment. So there are different kinds of therapies is cognitive processing therapy, cognitive behavioral therapy, dialectical behavior therapy, and cognitive behavioral therapy has been probably one of the leading ones in substance abuse treatment since I began my career in 2001. So that's a real common one in treating substance abuse. And medications is widely accepted depending on the type of addiction you're working with. There are the medication-assisted treatment programs now that are used for treating opioids. And just a reminder that treatment plan is a living document and is something that needs to be created with the individual that you're working with. And go to the next slide. Principles of effective treatment. This is from NIDA. Treatment does not need to be voluntary to be effective. I have worked with court-ordered treatment programs and have seen them be very successful. There are a lot of drug court programs throughout Indian country, and those have proven to be effective as well. I honestly call it leverage when I'm working with people that aren't voluntarily participating in treatment. And I want to say most of the people that do seek services don't voluntarily come in. They are often referred by social services and mostly the court system. Drug use treatment. During treatment must be monitored continuously as lapses may occur. I often advise clients that I'm working with when they see the physician, if they are in recovery, that they need to make that known to their physician when they see them. Patients should be tested for HIV, AIDS, hepatitis B and C, TB, and other infectious diseases, as well as targeted risk reduction counseling, linking patients to treatment if necessary. Can go to the next slide. Foundations for understanding the vocabulary, professional and ethical responsibilities, our values, our morals, and our perspectives as professionals working in the field, the distinction between legal and ethical dilemmas, and also our ethical values. Our scope of practice covers general counseling theories and treatment methods. Generally in the substance abuse area, we are doing screening, assessment and diagnoses, treatment planning and case management, individual, group, and family counseling, patient, family, and community education, and just knowing what you're qualified and you're certified, the services that you're able to provide under your level of certification or licensure. Like I said, I supervise some counselors in training who are still new to the profession and learning, so they have to do a lot of work under direct supervision. They can't just go out and be a full-fledged therapist. So I have to review a lot of their assessments, and the only diagnosis that they can make under my supervision is for the substance abuse. And that's based on the scope of practice in this area. And just knowing what your limits are and knowing that for things that you can't do, that you seek supervision or make a referral for services that don't fall underneath your scope. So this is specific to substance abuse. So there is a distinction between legal and ethical dilemmas. As you can see here, ethics are aspirational, concerns professional practices and standards. It's should, if not self-monitored, regulatory agencies can step in, safeguard the autonomy of professional workers, dynamic and evolving, often a matter of opinion and not always a legal concern. Ethics are there to protect the client, the counselor, the community, and the profession. So different professions have specific codes of ethics. My agency follows the NADAC code of ethics because that is specific to the addiction profession. The legal situation, these are laws. This is determined by federal or state statutes. It's a corrective measure effort to police the profession. Litigious legal fears versus professional integrity. Implemented if ethics are consistently violated. Civil and criminal law and enforcement sets precedents. So that's the difference between the ethical and the legal. The duty to warn. The Tarzoff versus Regents at the University of California in 1976. This is a well-known case that comes up in ethics discussions. It might be on the exam. And this relates to the court decision that if a person is in danger from someone and you have knowledge of that, we are required to notify legal authorities, the police, to make sure that no harm happens to another person. And also demonstrated to establish a duty to warn. So whenever I work with clients, I always let them know if you're a danger to someone else as a mandated reporter, I have to do that for safety reasons. So other than that, everything is highly confidential, but that's just an example of that case that comes up frequently in this discussion. Ethical values. This is the be good, do good, and above all, do no harm. Always the best interest of the client is first. Okay, go to the next slide. Our professional and ethical responsibilities are to adhere to the established professional codes of ethics, adhere to federal and state and agency regulations, interpret and apply information. These guidelines are here for you to follow, whether you're in social work, you're in nursing, you're in substance abuse, or mental health. So it's important to know your ethical codes. Professional and ethical responsibilities. It's important to recognize the individual differences. Like I said early in, everybody in the door is a unique individual with specific individual needs, and we need to do our best to meet those needs, utilize a range of supervisory options, and conduct self-evaluations of our own work. Your supervisor is your biggest resource for you to use whenever you're faced with any ethical decision making, whether it's routine or a significant event. Your supervisor, our manager, will likely have some experience and our precedents to assist you in making the right call. I have an open door policy, and oftentimes I really like it when my counselors in training are at my door and they're ready to process some issues. And we have regular clinical staff meetings every week, and I like to challenge them to bring something like a case or a vignette that we can discuss to review our ethics. Okay, go to the next slide. More on the professional and ethical responsibilities. It is our responsibility to continue professional education. In Wyoming, every 2 years, counselors have to complete 3 hours of continuing education. And here in Montana, they renew every year. So there's states have differences. And so it's important to know what you're required to do with your certification or licensure, but continuing education is very important to keep up with all the latest trends in treatment. Participating in ongoing supervision. It doesn't matter if you're new to the profession or you've been in the profession for several years. I have friends that I've known for years, and they sometimes contact me or vice versa, but it's important to have supervision. My program operates under CARF standards, so everyone that works in my agency must have supervision. And it's also important to maintain your own physical and mental health, keeping an eye out on your colleagues and making sure everything's all right. And as a supervisor, I always add, self-care as part of my supervision. And what are you, I always keep my mind open to, or if they're having any personal matters that might affect their work, and let them know that it's important for them to let us know. Maybe they need some time off, so that we have to take care of ourselves, because this is a tough job. It is challenging. So good ethics training provides a foundation for the clinician in the field mandatory reporting for children, and being able to do mandatory reporting if somebody might be in danger, and making sure our clients are safe as well. So self-care, like I said, self-care is essential. And this is the NADAC Code of Ethics. It's pretty extensive. Because I follow CARF standards in my organization where I work, we are required to review it annually. And because it's so broad and comprehensive, we have probably put 3 hours into it, and we're not even halfway through it. So that's how extensive it is. And like I said, I go by CARF standards, so I have to document that my staff actually covered this NADAC Code of Ethics. I'm hearing a lot of noise in the background somewhere. Steve.
Somebody's got an open mic. I'm just trying to isolate it.
Okay.
Please check to make sure you are muted so we don't have any interruptions. Thank you.
Okay, we can go to the next slide. The Code of Ethic examples for alcohol and drug counselors. This is breaking it down by category. The responsibility is always to our patients. Looking at any possibility of dual relationships, confidentiality, professional competence and integrity, responsibility to our students, employees, and our supervisees, our responsibility to this profession, any financial arrangements, advertising, legal and moral standards. So it's important to be aware of all these different parts of the ethical codes that we have to address. You can go on to the next slide. Agency ethics. Your agency ethics, there is a disclosure, if there's any disclosure of personal recovery, that is up to each agency, how they decide to do that. Again, because we're under CARF, we have our own set of policies and procedures, and we have a certain set of standards to meet the CARF accreditation criteria. And it depends on your role and how comfortable you are. So like I said, this is up to the agency to decide on the disclosure of personal recovery. I've known people that have had several years and they're very comfortable as professional counselors. We have to know the mandatory reporting, letting our staff know. Everyone in my office knows, even the front desk, because sometimes we get calls from people needing help. And if it's regarding safety of a child, we need to act on that. Acceptable practices and culturally appropriate practices. Being that we work in a Native community, we need to be able to offer the different cultural practices. So if you're in recovery, this question can be a slippery slope for some clinicians. And I often let my staff know that, if you're going to make a personal disclosure about yourself, to really think that through before you do it. And is it therapeutic? How is it going to help the client? Because it needs to be, again, for the client's benefit. So there are some agencies that are strictly against the counselors even disclosing any of that information. So we can go to the next slide. Ethical complaints. Again, this is all Iowa information. It's important that you know your state's ethical boards. In Wyoming, we have to do a professional disclosure statement. And in that disclosure statement, you have to provide the information to the Board of Behavioral Health should that individual have any complaints about your work. And you have to provide that information to the client. Here in Montana, they don't do it, and I don't know why. So sometimes I see stuff and I feel like I want to tell them that there's things they should do, but again, it's not my place. But I do share what I have learned in Wyoming with my staff, and we've discussed them creating a professional disclosure statement. You can change to the next slide. Patient rights. We need to let the clients know upfront that they have rights as a patient. Those rights include non-discrimination, confidentiality, responsibility and competence, and of course, the informed consent. They have to give us the consent to work with them and understand that not only do they have rights, but we have expectations of them when they participate in their treatment programming. Non-discrimination refers to not discriminating anyone based on their race, their age, or their gender, religion, socioeconomic status. We can't discriminate. We need to avoid any personal issues and be knowledgeable about special accommodations, especially under the American Disability Act. Under our CARF, we do have a form that we have to fill out for any clients that need any special accommodations, and it's called a special accommodations form. Sometimes we have people that have limited writing skills or vision, or they're handicapped, and we need to help them access our building. So we have to be mindful of those things. To the next slide. Confidentiality. We have to have all of our patients fill out a release of information form, and a consent for confidential information. This is in line with the HIPAA, the Health Insurance Portability and Accountability Act. And there have been some revisions, and there's a link there for you to look at that. Not any huge revisions to that, but client confidentiality is a huge one, especially working with Native community. I'm in a small reservation area, and it's really common for moms and grandmas and other relatives to come in and want to make appointments and get information. And it's really making sure that everyone that works there fully understands that we can't give any information to anyone without that client's consent. So we try to make that known on the front end. If you know anybody in your family that you might have call or come in, we can't tell them anything. So we have to make those appropriate provisions. Some people are sent to us by social services or the system. So those are usually required for them to give releases of information. But then again, they can actually specify exactly what they want to have released so that we don't give full information on them. So they can be real specific about what, if anything, they want you to share with anyone that they give permission to. We can go to the next slide. Again, you need to adhere to your federal and state confidentiality laws. The 42 CFR Part 2 is to know the exceptions to federal law and know how to respond to law enforcement requests on information. We only present the necessary data. And in this profession that we have, a court order would have to be provided requesting specific information, and always go to your supervisor. Do not go get some information and give it out. Never, never do that. Always consult your supervisor of your agency, because they should have some protocols in place to protect client information and under what circumstances anything, if anything, can be shared. The next slide.
Davis, I had asked the audience too if they are aware of the exceptions when there are exceptions to confidentiality. That's kind of a good quiz question.
That is. I
Yeah.
think that is one of our quiz questions coming up.
It might be. I don't know if we have any quiz questions on this PowerPoint, but it's a good one. So I just sort of put that out there to the audience.
Anyone have any knowledge of exceptions to this? Okay.
Is it if they're harm to their self or others, or
Yep.
Oh shoot, sorry, just popped out of my head.
That's one. That's one. That's a good one. Thank you.
Okay.
Another good
a medical emergency,
Yes,
and
exactly.
the person, only the information that would be pertinent to the medical situation.
That's correct. And usually there is a form in their packet where they designate a emergency medical contact person in their paperwork. Okay. I see Steve has audits on there. Specific to court orders. Okay, yeah, we had a lot of good responses. Thanks. Okay, the general rule, except under certain specified conditions, both HIPAA and 42 CFR prohibit use and disclosure of records or other patient-related information. Responsibility. This should be covered under policies and management, assist others with knowledge acquisition, and report unethical behavior to proper authorities. I think going back to the confidentiality issue, I have had a new staff member come into my program, and because we're going over the code of ethics in our clinical supervision meetings right now, I've had to remind certain staff members that it's not their job to know patients' information. You know, if you're the front desk receptionist, your job is to help that person make an appointment. It's none of your, you shouldn't be getting information about that patient's personal life. So I've had to really remind people that there's boundaries in their roles within the agency as well. Next slide. Again, back to the competence. Ongoing education is really important. It's good that you guys are all here today, staying on top of this and keeping this fresh in your mind. Again, those boundaries and limitations of our work, professional competence and integrity. I supervise staff, so I had one come in and say, well, their mom works in the community and she wanted to know how their son is doing in the program. And he says, I can't say anything. And she's asking me in a public place. So these are scenarios and vignettes that we process in our clinical supervision meeting. And I'm like, hey, that's a good one for our meeting this week. Let's write this one down and let's discuss this one. And again, being in a small tribal community, for me, it hasn't been a problem because I'm not from this tribe or know everyone here. But when I'm back on my reservation, it's a whole different thing because I'm related to a lot of people there. So it's also knowing your professional competence and having integrity about the work that you do and knowing what you may need to refer people out to other services that you're not able to provide. Oftentimes we encounter people that need psychiatric evaluations because it's a co-occurring disorder that they're presenting with. So knowing those resources are very helpful. The next slide. These are the basic ethical principles, and I'm 100% certain this will be on the exam if you're preparing to sit for the test. Autonomy is the first one. This is allowing an individual the freedom of choice and action, which also lines up with person-centered behavior. Again, we're CARF accredited, and so we have to show that we're providing person-centered services. Non-maleficence, not doing any harm to the clients. You always have to be asking yourself if what you're doing is safe for that individual and in their best interest. Beneficence, it's our responsibility to contribute to the welfare of the patient, to do good. Justice, treating everyone equally and equals unequally, but in proportion to the relevant differences. So being able to tailor things to meet specific needs. And fidelity, this is being loyal, faithful, and honoring your commitments so that the clients are able to have trust in you as their counselor. Boundary setting. Boundary issues. The first one is not doing any harm, non-maleficence, transference, patient to counselor, and counter-transference, the counselor to the patient. Again, as a supervisor and as somebody new to the field, sometimes we can be triggered by personal life experience or vice versa with the client of issues that might come up. And I've had some with some of my staff recently, especially when working with adolescents and their being parents or grandparents of adolescents and having to work with them. So reminding them to be mindful of those thoughts that might come up of working with a patient, but still feeling like, I don't know, it's having those notions of being a parent to that patient when you're not, that you're there as a therapist to provide therapy. So that transference and countertransference is a big one. So it's important that you know this one. I know this will be on the exam. So we have to be mindful of those. It can be tricky. So it's being able to self-monitor. You go to the next slide. The boundary issues, dual relationships, can be tricky in small towns, in small reservation communities. One of my staff recently moved from another reservation, and he talked about his significant other knowing several people in the community. And he said, I just told her, I don't want to know who all your relatives are because it could make things complicated for me in my work. Being on the reservation where I'm from, I've had my daughter bring kids home that I had worked with, but she didn't know. So sometimes those issues are tricky to manage, especially when you're in a small reservation community and you know a lot of people there. There is also the sexual and affectionate feelings versus actual behaviors. Like I said, I've been in this field for over 20 years, so I've heard several stories. I've seen some situations, and I've even supervised someone who had her license temporarily suspended. So this is a very, probably one of the biggest ethical violations is the sexual and affectionate feelings versus actual behaviors. So a lot of times it's not the counselor, but it could be coming from the client and being able to address those. So always knowing you have your supervisor there that you can go to when you need to resolve one of these issues. And remuneration, which is also known as bartering for services, or quid pro quo. Quid pro quo, kind of a tongue twister for me. Again, we don't want to be bartering for services, but a couple years back, I had an intern challenge me on the bartering, and the American Counseling Association actually says that we can barter for services. And I was trying to tell my intern, no, we can't, until they actually pulled out the code of ethics, and it is there. But again, it's up to the agency to decide how that will be handled. There can be specific policies and procedures set by the agency on how they want to address that. And I can't say which is right or wrong, but some people don't have a lot of money. But when you're working in, I want to say, because we're working with public federal funding under Indian Health Services, that we should hold ourselves to the highest standards in providing our services to our clients. So to be really ethical in the work that we do. And here's the mandatory report. Again, the Tarzok case. If someone is a danger to themselves or to others, we need to make that report to protect people. Child abuse, mandatory reporting. We've been doing some vignettes in our review of the NADAC Code of Ethics in my agency where I'm working now. And I've disclosed to them that early on in my career, I've encountered situations where I've had to make those calls. And I'm sure some of you out there have encountered some situations where you've had to make a mandatory report call. Okay, somebody's got elder abuse. That's another big one. And any sexual misconduct of a therapist. And I've actually had one of those early in my career. I encountered a patient who disclosed to me that they had actually married their counselor. And I was like, wait, what? Again, I went to my supervisors with that. Okay. Using supervision. This is a big, important topic. We need to pay careful attention to supervising our staff and making sure that everyone is doing their work ethically. So if there's any situation that ever comes up, you want to make sure that you document it. The supervision that I do is always documented. And here in Montana, what I've learned is you're not just supervising someone, they actually expect you to provide supervision in certain areas. Okay. So I always document everything that we cover. And again, CARF has certain criteria that has to be covered. And you can't always cover all of them, but it's good to test concepts, the rationale, and your practices of supervision. Supervision is to help your counselors provide good clinical services and ethical services. And not only do I provide supervision just to my counselors, I also supervise my administrative staff. I expect them to be providing the best services as well, and being able to evaluate the supervision as well. Doing a supervision report every now and then. I think every quarter I do a supervision report, and that just where I will note things that are going well, things that we could use some training in, and some things that could be improved upon. But I tell my staff, it's always to make us better, always to build you up and make you a better counselor. So it's good to have a report on the supervision of your work. Again, CARF requires you to have a supervision report done on a quarterly basis and annual basis, because it's that important to the work that we do. We can go to the next slide.
And I stand corrected, Davis. We do have some quiz questions in this module.
Yes, we have
So,
several.
I was able to create a short anonymous poll. So I'll let you introduce this quiz question, and we'll see where everybody's at here just shortly after we're done.
Okay. For this first question, a treatment counselor is contacted by a patient's medical doctor who's interested in obtaining information about the patient's progress. The patient has given permission to release information. The counselor should A, give the doctor a copy of the patient's file, B, give the doctor only information that is requested, C, refuse to release the information due to confidentiality requirements, D, set up a meeting with the patient and the doctor, E, ask the patient to give the information directly to the doctor.
Okay, so let's see what we have. I was able to create a quick poll on the fly. You'd be proud of me, Avis. I was able to do that quickly.
That is cool. That's the first time I get to see one of these on here.
Yes, and we've got our answers are coming in. We've got some good responses coming in, and yeah, you guys are right on with this. That's great.
Mhm.
Yes, the correct answer is B.
Mhm.
Well done.
And interestingly, I do get referrals from patients from their medical doctor. They'll be like, my doctor, I went to the emergency room, or I saw the doctor and they told me I should come get an evaluation. So I was like, pretty pleased to see that the physicians in this area are making referrals for treatment.
Yes.
Okay, the second question. A situation that would not justify a breach of confidentiality would be A, a patient has threatened to kill his wife. B, a patient has threatened suicide. A patient has sold drugs in order to support his substance use disorder. D, a patient admitted to committing child abuse. E, a court order stipulates that a patient's records should be released to the police. Which is not. Okay.
Okay, should we, let's see if
Okay,
I'm creating these polls on the fly, ladies and gentlemen, so.
cool. It's working out pretty good.
Yeah, you guys are, again, we see the results coming in.
Mhm.
Appreciate everyone's participation in this. And boy, Avis, they are right on the money here.
Mhm.
You may not agree with the patient selling, substances, but it's not a reportable issue that you would breach confidentiality for. So the correct answer here is C. Well
Mhm.
done. Okay, let's see if I can, we'll go on to the next one.
Question 3. An old friend of a clinician who has his own private practice suffers from a substance use disorder. Since he wants to help his friend, the clinician agrees to counsel his friend twice a week without charging for the sessions. This arrangement is A, ethical if the patient meets the criteria for non-payment on a sliding fee scale. B, neither ethical nor unethical. NADAC ethical guidelines do not address situations such as these. C, ethical, the clinician is providing services within guidelines for a private practice. D, unethical, NADAC ethical guidelines prohibit dual relationships such as the one described here. E, unethical, NADAC ethical guidelines prohibit pro bono sessions. Which is the answer here?
Okay, results are coming in, Avis.
Mm-hmm.
This is kind of a tricky one because there are really two possible correct answers, but there's one that fits this ethical code exactly. Okay, and again, our audience is right on. The correct answer here is
D,
D. Mhm.
good job. Okay,
Okay,
go to the next
Next one, yep.
question. After a clinician has written a case study on one of her patients and submitted it to a professional journal for publication, the clinician's supervisor, who is a well-known psychiatrist specializing in substance use disorder treatment, edits the document and writes 2 paragraphs. When the clinician lists the supervisor as the first author and himself as the second, the clinician has acted A, ethical, as long as the supervisor's last name alphabetically precedes the clinician's last name. B, neither ethical nor unethical, the ethical standards do not address trivial issues such as this. C, ethical by properly crediting his supervisor's contribution. D, unethical, the clinician should not have listed himself as an author of the article. E, unethical, the clinician should have listed himself as the first author.
This one's a little tricky too, but there's one that is the best answer here. And we've got a little more mixed result here. Let's give folks a chance to respond to this one. And this is totally anonymous, so you know, we're all learning together here. Got a few more chiming in. Let's give them a couple more minutes here, Avis. So we're good on time. So okay, we've got more than half of you chiming in. A few more coming in still. Are you guys able to see these results as they're coming in?
Mm-hmm.
Okay, well, again, this one, it may not be something we run into a lot in our clinical setting, but the correct answer here is E. Okay. Let's go on to the next one.
Okay. A patient who has been in therapy for 6 months informs her counselor that she is going to commit suicide. She claims that she has a gun at home and will use it that evening. The counselor's best course of action would be to A, keep the secret, B, initiate hospitalization of the patient, C, do an immediate evaluation, D, make a no suicide contract, E, call an emergency assessment team. What
I think
is
the
the
hint I'll
best
give you
answer?
on this one is think priority. This one's a little tricky too, Avis. I know when Avis and I have taught the alcohol and drug certification prep course, this question is one that can be a little tricky as far as choosing the best course of action in this particular situation. So again, we've got kind of mixed poll results. Again, this is good because we are learning together here. A couple more.
We have a couple more.
A little bit more opportunity here for folks to chime in. Okay. We're going to end that poll, and the correct answer here is
B.
mm-hmm.
But I can see why they would pick the other answers
Yes.
too.
Oh, yes. Other than, I mean, A, we know is ruled out. I think the distractor question is E, which most of you may have considered that. But the correct answer here is B. I know we've got a lot of folks chiming in. Yes, that's right, Nora. imagine if you're in a private practice and you don't have access to support or a team. So that's where that question is really asking you to prioritize here. Okay.
Yes. Number 6, your patient who was just sexually assaulted knows who attacked her, but doesn't want to press charges. She says a trial would be too disruptive to her family. She lives in a small town. Her children are in junior high, and her husband has a high-profile position in the town's largest company. What is your first responsibility? A, to call the authorities. B, to confirm that she has received medical attention, and if not, to have her go to a doctor immediately. C, to treat her and keep everything confidential. D, speak to her husband about their social responsibility, and to treat her but assert privilege.
And you can see in this question, we often talk with folks preparing for the exam, the word that is in all caps, first responsibility. That's my friendly hint of the day. I always need hints when I'm doing multiple choice. I don't test very well, so. But think about the first responsibility here. Okay, we got pretty good response here. You guys are right on with this.
Mhm.
Couple more responses trickling in. Okay. Yes, so the correct answer here is B. That is the medical priority here in this case.
Mhm.
Okay. Well, I forgot we added all these wonderful ethical quiz questions. Okay, here comes the next one.
Okay. The goal of confidentiality is A, to protect the public, B, protecting the counselor, C, protecting the profession, D, protecting the process, and E, protecting the patient.
The goal of confidentiality. Oh, yes.
Okay.
They're right on with this one.
Yep, they got that one right from the get-go. I like that.
Yeah, well done. Yeah, the correct answer here is E.
Yes.
Protect the patient. Okay.
Next one. The goal of ethics is to A, protect the public, B, protecting the counselor, C, protecting the profession, D, protecting the process, and E, protecting the patient.
The goal of ethics. This one is a little trickier, but go with your go with your instinct here. What are those ethical guidelines that you follow in your profession? What are they designed to do? Okay. We've got a little bit of mixed review here, but overall, you guys are on the right track. few more answers coming in. Okay, we'll end that poll. The correct answer here, Avis, is
C.
C. The goal of ethics is protecting the profession. Okay. We're getting close. Just a couple more here, I think, and then you guys will be off of the quiz parade here.
I got too many wrong. I don't want to play this game
Yeah,
anymore.
that's right. Well, we're learning. That's we want to be learning together. Trust me, I missed several of these the first time I took them too. This is good though. This will get you thinking and reflecting a bit. And we know one of the things that Avis and I know is that ethics is a big piece of a lot of the testing
Exam.
for LPC or for your certified addictions counseling credential. So it's important to have a good working understanding of ethics, and you'll be able to use these CEUs too towards your credentialing requirements for ethics. A lot of fields I think require 3 or 6 CEUs of ethics per licensure or recertification.
Mhm.
Okay. This is another interesting question. I think we may have even reworded this in our modules because there was some questions about this question. But here we go. Davis, take question 9 here. I'm going to get the poll ready.
Okay. Which of the following presents the greatest risk to confidentiality? A locked file cabinet in view of waiting patients. B, a computer on a desk in a counselor's office. C, a large family in a therapy session together. D, making referrals. And E, an individual counseling session located next to the waiting area. What is the greatest risk to confidentiality here?
Greatest risk. I liked how you emphasized that word. Greatest risk. Let me get this poll up here and we'll see. Now, these may all be confidentiality risks, but which is the greatest? Yeah, this one, we did reword this question a little bit because we had a lot of folks struggling with this question, but it's important. The greatest risk. Avis, are you ready to defend the answer on this one if we get some pushback?
It is a tricky
This is a
one.
tricky one. I missed it. Believe me, I missed it the first time as well until I sort of stepped back and processed it a bit. But let's take a look. Yeah, it looks like this one again is one of those questions we did reword this question a little bit in our training module because it was a little bit misleading. But let's go ahead and look at this. The correct answer here, Avis, is
C.
yes. I know it's all of these are potential risks, but think about the factors involved in having a large family in a therapy session together, the potential for them to share information outside of that session. It poses the greatest risk to confidentiality. All the other ones are also issues. But according to our sources, this was identified as the greatest risk. So don't be discouraged. I missed it. I think Avis might have missed this one when we first tested these. So yeah, don't be discouraged on that.
This is
Okay.
Carol. I answered B just because I didn't know if it was locked or unlocked the
Yeah,
computer.
exactly. And I think that's when we reworded this question in our testing module, our prep module, we did change it. We changed the wording on some of these to make it a little clearer, because these all pose risks.
Mhm.
But yeah, that one, you're not alone in this. We had a lot of questions about that particular one. So let's for lack of for time purposes, let's move to the next one. This is the final quiz question, so you can all rest assured we'll go easy on you here. But Avis, take it away.
An adolescent outpatient treatment therapist is contacted by the patient's father, who is asking whether his daughter has been attending group sessions and if she has been reporting continued abstinence from alcohol or drugs. The adolescent patient has given permission to release information to the father only regarding attendance and participation. The counselor should: A, release of informations are not needed for patients under 18, so provide the father with a full progress report. B, give the father only information on participation as requested. C, refuse to release any information without talking to the patient first. D, set up a family session with the father and daughter to discuss any concerns. And E, ask the father to ask his daughter himself directly about her attendance.
When you say adolescent, that means underage?
Yes, under the age of 18.
All right.
Okay, Avis, we're getting some responses coming in.
Mhm.
Are you guys able to see these coming in, or maybe just Avis and I? I'll share the results here with you when we're done.
Mhm.
Got a few more folks coming in. Again, this is anonymous. I can't tell who's answering these and how, so
Mhm.
we're not here to call anybody out, or this is just really to get you thinking about some of these ethical dilemmas or this ethical decision making. Okay, we've got about 60% replied, so let's go ahead and share those results. And again, here, this you think about releases of information, and the other piece driving this ethical decision making is, and I'll speak to the Iowa laws of confidentiality. In Iowa, adolescents are afforded identical rights to those of adults when it comes to the receiving of substance use disorder treatment services.
Mhm.
So that really was driving, as I looked at this question, was driving my decision. But then we also look at what happens in a release of information. By law, it needs to be specific, and the patient has the right to choose what is and is not released.
Mhm.
So the correct answer here is B.
Mhm.
And it should probably say give the father only the information on participation as noted in the release. That might have made it a little, because he's asking, I think, he wants a full report. Is that
Mhm.
he's asking whether she's, oh no, he just asks whether she's been attending group. And he asks if she's not currently using. Well,
Yes.
she is not given permission to release that, only her attendance. So, I mean, we may need to change the wording on that as well.
Mhm.
But that's, you guys, most of you were spot on with that.
Mhm.
Only giving the information that is is identified on the release that the patient wants released to the requester. So great. Wow. That was fun. I'd forgotten we put these quiz questions in there. Avis had mentioned earlier, I remember we got some quiz questions and I thought, did we put those in here? And yes, we did. Gosh, I had to remember that. And then I saw them coming up. So, okay.
Yeah, this is probably the most we've put in for the online webinar. So I think this has been good. So just to summarize today's presentation, some of the things to remember would be good, do good, and above all, do no harm. Distinguish among ethics, morals, and legalities. Patient rights are always foremost important. Your ethics can greatly impact the quality of patient care and the image of the profession. Boundary issues start with small, innocent transgressions. So, like I said, the self-monitoring and using your supervision is very important to this profession as you work with people. And these are the references. Hey, thank you, everybody who took time out of your schedules to join us today. And I hope you found this very helpful to those of you who are preparing for the exam. And we do offer these every month, the first Wednesday of each month. We can open, we have a little bit of time left. If anybody has any questions, I can take some questions.
Yes, we've got about 8 or 9 minutes, so let's open the floor. I know there was quite a bit of activity during our quiz question section, so I really want to just thank you. Thank everyone for participating and being in on that discussion. So let's open the floor. Feel free to unmic. Avis, they were asking if they could have your email. Someone had asked for your email contact. So
Yes.
if you're okay with that, I can post that in the
Yes.
chat.
Yes. I do get requests. I do training, so I've gotten a lot of training requests from being here online. And you can put my email out there. That's perfectly fine.
Can I put should I put your university or your Gmail? Which do you prefer?
Use the Gmail.
Okay, great.
Yeah, I just got called back to my own tribe on my reservation, and they saw one of my webinars and they want me to come home and do some training. So I was really happy to see that we were watching your webinar. I was like, cool.
Hi, Avis.
Hi.
Thank you for you and Steve for doing this. And I'm still pouting about how I missed that question about the suicide. And
Don't let it get you down, Gene.
I know.
We're learning
like,
together here.
Somebody threatens with a gun. You gotta call somebody first as you're doing the typing. You know, that was always been my concern. But I want to ask you, what I have run into lately in my community, which is in the middle of South Dakota, we are Dakota, and the comments are for counselor support. They don't want to go into the Indian Health Services because it's someone who's not Native, and that they're and I found this interesting that they would say, you know, they have different clothes, and I've been over to our clinic and I don't see that different clothing thing, but they're not here. They leave off the reservation because they don't understand us. And I see it as a defense, or maybe even an excuse not to go in. But I encourage them to invest in themselves because that's what's needed at this time to help them get sober.
Mhm.
What else would you suggest to do? Because I feel like I'm just grasping at straws, trying to find something to encourage them.
Well, what we're doing in my program is I do see clients. I am a clinical supervisor and I have two other licensed addiction counselors, and they are also master social work, licensed clinical social workers. So there are three of us on staff that can provide mental health in the agency. So we give them some options. They can
Oh,
choose to see one of us in the building and or go to Indian Health Services. And our counselors at Indian Health Services, two of them are native. They are very, very busy though, and they're very short-staffed. So the reason why we're doing more mental health in our program is because if any one of us makes a referral to Indian Health here in our area, their appointment is going to be a month away.
yeah.
And by then they're going to fall through the cracks. And what we've been doing is I kind of revamping the whole program setup. And we've been setting, I kind of took a model from another recovery program from back home that I think is just perfect culturally. And it goes by hours. So we tell them, if you go to your counseling appointment, you'll get an hour towards your treatment hours that you need to earn for your level of care.
Oh, okay.
So it's kind of an incentive for them. And, you know, I've shared with them, I go to counseling sometimes myself just to vent, you know. We have to take care of ourselves. And culturally, it wasn't something I always wanted to do, but in my training, I was required to go attend counseling as part of my professional training. And once I was like, oh, this is kind of cool, you know. And so sometimes there are issues that I would like an objective opinion to. So a little bit of self-disclosure about myself. And I share about, you know, some personal disclosure of people that I know that have struggled with anxiety and depression. But because they have continued to take care of themselves by going to counseling, getting therapy and or medication, that they've learned how to manage those issues and put them at less of a risk for relapse, because some of these people may have, it's kind of hard to tell if the substance abuse problem came before or after the substance use problem. Like, were they depressed and started drinking to cope? So, and I also talked to them about coping skills and even providing that education within your program of having a group where they can talk about depression and anxiety and learn some coping skills, because I really think not everyone needs medication. I think if they can learn some coping, it would be really helpful to them. But I do know Indian Health Services is also going to be expanding their mental health and psychiatry department with some telehealth work. And I'm actually personally meeting with the director of the behavioral health next Friday. I'm hoping that we can collaborate as a team, because it's so siloed here that I think a more integrated approach needs to happen within tribal communities that are working with Indian health and substance abuse, and they're kind of disconnected, to be able to work closer together to better meet the needs of the people that need it. And I feel like some of them may be putting that out there as a reason not to go.
Yep.
But also being mindful of our traditional healing methods, because a lot of treatment programs do incorporate traditional healing, such as sweat lodge is quite common. And I've seen those to be just as effective as well. And as a Native person who, I guess, I consider myself to be an Indigenous therapist, in that I've been through some things in my life, but I was raised by my grandparents who were traditional and taught me their ways of how to help myself, that I know it works. Like I'm living proof it works, you know? And I feel like we need to continue to practice our culture too. So not to close that off to modern, you know, Western therapies, but to see is maybe it might be something to be explored that as an
agree.
encouragement. Like I said, it's been kind of an incentive because we have a little form for them that says you have to get a, you know, a signature. Like even going and getting the physical will count that as an hour of their treatment.
Oh, that's a really good idea.
So, you know, when you're using, we're not taking care of our health. And now
Yep.
that you're trying to get well, you know, go see the doctor and get your blood levels checked and make
There
sure
you go.
you're tending to your health needs.
Yeah, our community is very small and we have one substance abuse counselor. And there's been a position open for a few years, additional. So she does the counseling and the assessments.
Wow.
So, and she's very good, but you gave me some good ideas and I'm gonna call her and see what we can, those other ideas to work them out. So thank you.
Thank you.
Yeah.
You're welcome.
We are out of time, and I want to honor everyone's schedule, including Dr. Garcia's. And I just want to again thank everybody. Some really great comments and interaction in the chat, and I appreciate all of you participating today and staying with us. So until next time, we'll broadcast again. Our ESAS series broadcasts the first Monday of every month, and we'll have Avis back again later on in the year. I have her and another one of it's our current interim co-director will be presenting next month. So Dr. Kathy Tomlin will be here with us. So hope we see you then. Until then, please, if you have a chance to fill out that brief survey, please do. If you don't get a chance to do it today, look for our follow-up email. You can request CEUs at that time. We'll also include a PDF copy of today's presentation for you to use in a good way to help yourself and colleagues in the field. So again, thank you so much to Avis Garcia for being here today, and to see all of you and be with all of you today has just been fantastic. Until next time, please stay safe, stay healthy, and most importantly, stay connected, everyone. Thank you.